Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. We're going to talk about emergency medical services, EMS. We're going to talk about CPR training and the new Stop the Bleed program. Now, you know that we are so proud of our first responders and our servants, whether they be police and fire or otherwise, that are the first ones in to help us. So we're going to talk about the people who do a lot of that training. Let me first introduce Darren Cohen, Dr. Darren Cohen, who is the chair of emergency medicine here at Nova Southeastern University College of Osteopathic Medicine. Welcome, doctor.
Thank you for having us.
Good to have you. And someone that I've known for a long time, Jim. How do I know you for a long time?
Long time.
Long time. A very famous name in my life. Jim Gargiulo is the EMS Lead Instructor that works within the Department of Emergency Medicine here at Nova Southeastern University. Both welcome, guys. Welcome.
Thanks for having us.
Dr. Cohen, talk to us in general about our program, the emergency medicine program, the EMS program, etc. Go ahead.
So currently our program is useful for training all of our health profession programs at NSU. So we train all our physician assistants, osteopathic and allopathic medicine students, along with physical therapy, occupational therapy. We train them in basic life support, and also those that needed the advanced cardiac life support and pediatric life support. And also we train members of the community as well in our Heart Saver training, which is training them in CPR. Which we'll discuss later. One of the components that we've done recently is integrate the Stop the Bleed training into these courses so that we can try to disseminate some of this life-saving information.
And James Gargiulo, tell the folks of your background, because I certainly know of your background.
Well, I've been a firefighter paramedic for the city of Boynton Beach. I've been there like 18 years, and I've been teaching the programs here for Nova, all the ones that Dr. Cohen talked about, for the last 17 years. So I've been kind of like the main instructor and administrative guy that runs our EMS office.
You know, I have to stop right here because, again, I in the lead into the program, I said the amazing respect that our viewers have, and then really the whole nation has, for our first responders. How the EMS, EMT paramedics that go into these unfortunate situations, whether they be the unfortunate thing like what happened in Margaret Stoneman Douglas, or whether it be these shootings that happened just recently in other areas of the country, in California. You know, the police and are right in there. The EMS people, the EMT people are there right away. I mean, it's amazing. So again, I give great honor to your profession, but I think the people would like to know how you do relative, or what you provide in training for your colleagues as they come into the area of the fire department and become EMS, EMT paramedics.
Well, basically, to become a paramedic, firefighter, EMT, you're going to go to school for, anywhere from 2 to 3 years, where they learn a lot of the training for fire and EMS and all the life-saving techniques. Basically, what we're doing here is we're recertifying, we're basically reminding them we offer that training, so then that way, hey, you might not have saved someone's life with a Stop the Bleed over the last couple of years. You just might have been fortunate not to have that situation. They can take that training with us, and we can review the steps and basically remind them of the things that they have already learned that they might have not have done for the last couple of years. So,
Dr. Cohen, again, Jim Gargiulo just related to it, so I was going to get to it a little bit later in the program, but let's get to it now. The Stop the Bleed program, which has become so knowledgeable to the viewers through these horrible events, the synagogue killings, the recent killing in California, the Margaret Stoneman Douglas issue. What is the Stop the Bleed program?
So it's formed, and I think in 2012, a joint thing with the White House and the Department of Homeland Security of how that we can try to stop these not stop the shootings, but the outcomes with them. And nothing's worse than the deaths that occur with these shootings, but preventable deaths are even worse. So how can we try to prevent some of these deaths? So the Stop the Bleed campaign is useful to educate the community. It started with educating the public servants, so police, fire, but also to educate the ones that are going to be there first, because people die from some of these injuries within 3 to 5 minutes, and that's much faster than response times from police or fire. So what we could do is train the public in how to stop preventable deaths. So with the kit, which we can show later, there's things in there that can help stop the bleeding. So we start with direct pressure. If that doesn't work, a pressure dressing. If that doesn't work, lastly, a tourniquet to try to save someone's life.
No, again, not to dominate the show, but you know, there has been, people want to know, you know, because there's been so many comments made through television media and through print and social media about the bleed out of individuals that are shot. The Stop the Bleed issues and the kits will, I believe, very shortly become as ubiquitous, as widespread knowledge to the general public, unfortunately, but fortunately, as CPR has become. Jim, you, like I said, you've been a firefighter for so many years, but who would have thought when you first learned and you were certified as a paramedic that you would go into a venue where the caliber of the weapon was such, or the velocity of the bullet was such, that it would cause such a bleed that people would die within 2 to 3 minutes. Am I saying something which is...
It's definitely unfortunate. When I got hired, you know, way back when, you know, we would deal with a normal shooting, maybe a couple people shootings, maybe some gangs, but now, you know, these automatic rifles, they're able to shoot off a mass amount of bullets, and a lot of people are getting hit and they're bleeding, and you just don't have the resources or the people that are able to get on scene and take care of them that quick. Another thing that people got to realize is that, you know, the police officers are the first ones on scene. Before EMS or any, you know, local medical personnel even get to go in there, they have to secure a scene. Because if, you know, we're going in there unarmed and then something happens to us, well, then who's going to be there for, you know, the people? So, you know, it takes a little bit of time. The average response time is 4 to 6 minutes for fire rescue. So they really are being aggressive with these Stop the Bleed kits and these programs to get the bystander to take care of the 3 major steps that Stop the Bleed really is.
And along with the training, you know, probably when you went to paramedic school, we didn't even go through, you know, the use of tourniquets, because, you know, they haven't had a good reputation. I mean, tourniquets have been around, I think, since 1500s in battle, but then during some of the wars, what happened with tourniquets, they were on for extended periods of time and people were getting gangrene and losing extremities, so then people said, oh, well, tourniquets are a bad thing. But I think we've learned a lot from our military, especially within the last couple of wars, the usefulness of tourniquets, and we've taken that knowledge and applied it now to the civilian use. But before, we always thought tourniquets were a bad thing, but now we know they could stay on, you know, for an hour, hour and a half without causing, you know, permanent damage, and we're trying to, you know, save someone's life with its use.
I want to talk about CPR, which has been probably one of the most valuable elements of training for John Q. Citizen, as well as the professionals, to help people that have cardiac problems, breathing problems, asthmatic problems, everything from falling into a pool to a bathtub or whatever. So let's talk about CPR. Let's explain to the people exactly what happens with CPR.
So I think there's been some changes since 2015 that some people might not be aware of if they haven't taken a class recently, and really the focus is on compressions, and whether you want to do mouth to mouth, that's really not necessary anymore. It's really getting your hands on the chest and doing compressions until an AED is available, which we can talk about, or first responders get there. But it's important really to get your hands on the chest and feel comfortable giving someone chest compressions if they're not breathing normally and they're unresponsive. So a couple changes have been made from 2015. We used to want to know if the patient is breathing at all, and now we know that patients that are not fully responsive, they might have a little bit of breathing. So what we tell people now is if there's any abnormal breathing and they're unresponsive, to go ahead and start compressions and do them, until someone else can come help you, because that's what's going to save someone's life. And it's important not to stop compressions once you start, because every time you stop doing it, it takes about 7 to 8 compressions to get back to the output that the heart's, the cardiac output that the heart can give every time you stop. So it's important once you start, to keep going until someone's able to help you.
There's a compression in this area, and that does what?
Basically, when you're doing the compressions, you're collapsing the rib cage on top of the heart and mimicking the heart actually squeezing and injecting blood out through the body. So you basically have to push hard, you basically have to push fast, otherwise you're not going to get a deep enough compression to actually make the heart squeeze and inject blood out through the body, which we all know is vital for all organs to survive.
And for our brain to have the blood flow to stimulate the organs to continue to work as they're meant to work, correct?
Correct.
Right.
They want you to push hard, they want you to push fast. We're trying to do up to 120 compressions a minute, and that's basically kind of what the new guidelines kind of told us, that pushing hard and pushing fast is clinically keeping that person alive until fire rescue, EMS personnel can get on scene, take over, start injecting, the medications that they really are going to need to kind of get that heart to start pumping again on its own, hopefully.
And it's easy to say push hard and push fast, but a lot of people are afraid, not only liability, but a loved one falls, they don't want to hurt the person. So, we do offer these classes here, and we have mannequins that you could practice on and see. We have devices that go on the mannequins to make sure that you're pushing hard enough, or if you're pushing too hard, and to make sure that you're at the right the rate. So it's important not to take a class so you can see what it feels like to actually give compressions to a mannequin, so in case you have to do it in real life.
And I would be remiss if I didn't mention the fact that in the state of Florida, at least, and it depends, because it depends upon each state, there are some Good Samaritan laws which enable individuals to be protected. Let's talk about AEDs, because I'm very proud of the fact that Nova Southeastern University, as recognized by the American Heart Association, we are completely covered with AEDs, or availability of AEDs. So talk about that. What are they?
So AEDs are automated external defibrillators, and they're used for the layperson to defibrillate a patient. So when most people collapse, it's usually from a cardiac origin, and there could be 2 rhythms that what we consider that you could shock, which is ventricular tachycardia or ventricular fibrillation. So what you do is, all around campus there's these AEDs, so someone should be starting compressions as soon as possible while someone else goes and gets the AED, and then there's instructions. Once you open the machine, it starts telling you what to do. So it'll tell you step by step, hook up, put the pads on the patient. It'll give a rhythm of the patient to see if it's something that we could give electricity to, and if it is, it's important that no one touch the patient when the electricity is given, and it will prompt you through all these steps. But that's really the thing that's going to save someone's life. You could do CPR for hours and nothing happened until they get the shock. So if EMS is going to take 4 to 6 minutes to get there, and we can give electrical shock to the patient within a minute with having these AEDs all around campus, that's what's going to save someone's life. And we've had an incident here where the AED was used on campus and saved an employee's life here. So I think it's excellent that we have had this initiative, and we continue the training with our employees and staff so they feel comfortable using these devices.
Well, it's interesting. Within the recent 6 months, I was flying to New York City, and I was going through one of the terminals at Fort Lauderdale Hollywood International Airport, and someone collapsed. Someone jumped in, did CPR, and then came your colleagues who were assigned to the airport, and they came in and pulled out the AED, and boom. I mean, they were working, and it works. I mean, and I think the public has maybe the wrong view of it.
There's relatively no danger to the person utilizing the AED or anyone nearby as long as their hands aren't on the person. AED is designed to have the pads on the chest. It's designed to shock into the muscle tissue of the heart and hopefully, stop it and restart it at its normal beat, reset the pacemaker, so you will. If you're touching the patient, yeah, you're definitely going to feel the shock, but as long as you stand clear and keep your hands and body away from the patient when they get that shock, there's usually not an issue at all.
And Dr. Cohen, I know you were here. I mean, you've been here since you're a little tyke.
Yeah.
But you were here when we started the AED program and started to put it throughout the campus. And I know there's been many, not an abnormal number, but I know there's been a lot of utility of the AEDs.
Studies have shown the quickest you can get to electrical conversion, the outcomes are much better to neurological outcome. So it's important that people feel comfortable using these devices. So again, it's good that we have them all around, the state and around our campus, but it's important that people feel comfortable, not someone bring the AED, and even though it prompts you through the steps, you need to feel comfortable, doing that. So if that's something that, you don't feel comfortable with, it's very important to get training on that so that if something does happen to one of your family members or colleagues, it's really something that can save someone's life.
I understand we're still training some different jurisdictional elements of the fire departments here. I know we were for a while.
We train employees at Broward Health, but we also on the third Tuesday of every month have open to the community. So if you're interested, we'll supply our phone number and email address to sign up to take classes as well.
Right. Are they presented with? Are there any costs to that?
Yes, there is a cost, and
it's minimal.
Minimal.
Yeah, it's minimal.
But it's a cost of, when you talk about cost of saving, someone's life, we have to, the equipment and stuff is something that we have to supply, but, that's the cost of your knowledge to be able to, save a loved one's life.
Well, we had a couple of programs here over the last few years about drownings. The state of Florida, unfortunately, leads the nation in drownings. But that's because we have more swimming pools and water around us than probably any state in the union, really. But it's amazing to me how many times I hear from people that you train, your colleagues who are EMT paramedics, I hear it all the time about how if they get to that, it's usually child, but it could be adult as well, they get to them quick enough, how they save their lives.
Well, basically, when someone goes into cardiac arrest from drowning, it's from being submerged under the water. They're not breathing. When you're not breathing, your heart eventually stops. It didn't stop because of cardiac issue. It didn't stop because of drug use or any medical thing. It basically stopped because you weren't breathing. So the quicker you can get the CPR, the quicker that we're able to circulate, ventilate, and then more times than not, they start breathing again. And basically at that point, we take them off to the hospital and then we have them monitored. Having that water down in their lungs could present infections and other problems down the road, but to get them breathing, to get that heart beating again, and the blood circulation usually is what's going to save their lives quickly, and they usually respond majority of the time.
So, Dr. Cohen, like I said, you've been with us for a while, even though you're a young guy. But you've been with us for a while. The evolution, I remember very clearly Dr. Morton Terry, who was our founder of Southeastern University Health Sciences, now Nova Southeastern University, how devoted he was to making sure that all of our graduates had CPR training. And in fact, you couldn't graduate without it, if you might remember. Yeah. And I think it's really almost a call out to the general public that, our state university systems ought to have it. And I don't know, to be candid, I don't know whether some of them do and some of them don't. But it would be of such great value for people to understand how to do CPR. Even some of our educators that our public education system, it would be very, very helpful. Am I going up the right street here?
Yeah, I mean, the more people that we can train in CPR, lives are going to be, saved. So I think it's a great initiative that we started here in training all our health professions. But I think there's, more that we can do to make sure anyone coming onto campus in terms of employees and staff and faculty all are trained, and trying to get out to the community and getting community members in for this, life-saving training. So we've done start with training all of our health professions, but I think there's more to expand this into getting everyone trained in our area.
That's good. I want to get back to something we spoke about in the beginning about Stop the Bleed. Just try to explain really what you're doing with these kits, because I understand that a lot of first responders, particularly police departments, are now placing Stop Your Bleed kits inside of their vehicles.
Right. So all of NSU has a relationship with the city of Davie, and all of our AEDs on campus have a Stop the Bleed kit. And also the city of Davie is paired with a lot of businesses to have these Stop the Bleed kits everywhere. Also, I read that all the Broward County schools also have these kits, and I believe Memorial Hospital has been doing training with them, their Department of Trauma, to train the educators at the local schools on how to use the kit.
It's something which, if you learn how to use it, it doesn't take much, in quotes, I'm not denigrating any of your education, but it doesn't take much training to use that kit.
Right.
But yet you can stop someone from dying.
Right. I mean, the main thing, is there's some first aid that needs to be done first, like we talked about, putting pressure on a wound, and we're not talking about, a cut to the finger, just applying tourniquets. So part of the course that we give is defining what life-threatening bleeding is. So life-threatening bleeding is, if there's pooling of blood on the floor, if there's continuous, spurting of blood into the air, that's considered life-threatening bleeding. And we're talking about extremities, so tourniquets can only go on an extremity. We can't put a tourniquet across the chest. So you want to apply the tourniquet as high up in the extremity as you can, and it's a painful thing. So the patient's not going to like you putting it on, but unless you put it on tight to stop all the bleeding, it's ineffective. Some of the studies have shown that people don't want to put it on too tight, and then what you have is you stop some of the bleeding, but you stop the arterial, but not the venous bleeding, and then you have more blood loss. So it's important with this class that you know how to put a tourniquet on and the safe way to apply it.
Good. You believe, I understand that our organized firefighters, EMT paramedics, have really embraced the opportunity of having these Stop the Bleed kits disseminated amongst their vehicles, and that's my understanding from talking to some of the leadership inside the firefighter community.
Yeah, it's good to have, all the pieces that you need to stop the bleed, whether you're stuffing the wound, whether you're using direct pressure on the wound, whether you're using the tourniquet. It's basically everything is in this one kit. It's handy. You're not looking through, the big bags and equipment things that we carry around. So it's right there. It's kept together, and you can utilize it quickly.
That's good. Well, we're down to the last couple of minutes of the show. There's so much to really talk about, but again, to look out at the viewers, they've seen these trauma events that have been repeated over and over again, unfortunately, on television and other media. And I just thought it would be a perfect time I was originally going to ask you both to come in and talk about CPR and talk about the EMTs, the AEDs, I'm sorry. And then all of a sudden now with the Stop the Bleed issue has become so knowledgeable and paramount to the public, I said, gee, give us a good opportunity to talk about Stop the Bleed. Yeah. So here we are. I want to thank you both of you for your dedication to our emergency medicine program. Darren, what can I tell you? You're part of our family, so we love you. And James, you've been part of my family for a long time. So I'll take the last 30 seconds with both of you. What do you got to say, Dr. Cohen?
I think just, mostly about Stop the Bleed. There's studies that showed that the use of tourniquet is save someone's life by 6 times fold with these trauma patients. So we need to get these Stop the Bleed kits out and make people familiar with how to use them.
And Jim Gargiulo, lead instructor here at Nova Southeastern University. What's your thoughts?
Well, I think the CPR, the AED, and the Stop the Bleed are all 3 things that are necessary for saving someone's life. You know, we do a good job here at Nova. We've been doing it for years. It's not intimidating. You know, we have fun. We'll teach them what's needed out here, and hopefully, like you said, it'll make everyone better lifesavers.
That's great. Well, folks, I hope that that we gave you a good amount of information. If you want any answers or you have any questions relative to EMS, CPR, AEDs, Stop the Bleed, just send in your questions, and here's a telephone number and an email address, and we'll try to give you the answer. Remember now, we're going to put up a telephone number and an address for Dr. Cohen's emergency medicine program. Dr. Darren Cohen, DO, is the chair of emergency medicine here at Nova Southeastern University. Any information they may want, just call this number and he's going to give you the answer. So thank you once again for turning in to our show. We appreciate you watching and giving us new ideas. Remember, this is your show, and a lot of the information that we try to present to you comes from your questions to us. This show is called Dateline Health. I always tell you to take good care of yourself, but in this case, I'm telling you, think about CPR. Think about Stop the Bleed kits. And my name is Fred Lippman. Until next time, see you.